Hello everyone, welcome back to the channel. In this video we will see about the anatomy of mediastinum. So first we should know about the chest cavity. It is bounded by the chest wall on each side and below by the diaphragm. It extends upward into the root of the neck about 1 finger breadth above the clavicle on each side. This cavity can be divided into a median partition known as the mediastinum and the laterally placed pleurae and the lungs. So mediastinum is a partition between the two pleural cavities and the two lungs, as we can see in the diagram. Superiorly it is extending to the thoracic outlet and to the root of the neck, and below we have the diaphragm. Anteriorly we have the sternum and posteriorly we have the vertebral column. So this is the transverse section of the thoracic cavity. In this we can see the location of the mediastinum, which is lying between the two lungs. This is the lateral view of the mediastinum. Here we can see the anteriorly placed sternum, posteriorly placed the thoracic vertebrae, and below we have the diaphragm, and superiorly we have the superior thoracic aperture. Now we come to the divisions of the mediastinum. So mediastinum can be divided into two parts with the help of an imaginary plane which is passing through the sternal angle on the anterior side, and posteriorly it is passing through the lower border of T4, that is thoracic fourth vertebrae. So the area of the mediastinum which is lying above this plane, this is the superior mediastinum, and the area below that we have the inferior mediastinum. Inferior mediastinum is further divided into three parts. This bluish color area is the anterior mediastinum, this orange color area is the middle mediastinum, and the green one is the posterior mediastinum. So there are three subdivisions of the inferior mediastinum. So here we can see the anterior, middle and posterior mediastinum along with the superior one. Now first we discuss the superior mediastinum. Now the boundaries of the superior mediastinum, as we can see in the diagram, anteriorly we have the manubrium and posteriorly we have the four thoracic vertebrae, that is upper four thoracic vertebrae. On the sides we have the mediastinal pleura. So this is the mediastinal pleura. The pleura which is lying the mediastinal surface of the lung is the mediastinal pleura, and superiorly we have the plane of thoracic inlet which is bounded by the upper border of manubrium on the anterior side. Posteriorly it is bounded by the upper border of thoracic first vertebrae, and laterally it is bounded by the inner border of first rib. So these are the boundaries of plane of thoracic inlet. And inferiorly it is bounded by the imaginary plane, as we can see this yellow color plane which is passing anteriorly through the sternal angle and posteriorly through the lower border of T4 vertebrae. Then these are the contents of superior mediastinum. The muscles are sternothyroid, sternohyoid, longus colli. Then we have the thymus gland in case of childhood and puberty. The veins are the superior vena cava, the right and left brachiocephalic veins, and left superior intercostal vein. The arteries are the arch of aorta, brachiocephalic artery, left common carotid and left subclavian artery. Then we have trachea and the esophagus. Various nerves are found in this, that is vagus, phrenic, cardiac plexus, and the left recurrent laryngeal nerve between the trachea and the esophagus. Also we have thoracic duct, lymph nodes, brachiocephalic like tracheobronchial and paratracheal group of lymph nodes. So here we can see the contents of superior mediastinum, that is the arch of aorta, superior vena cava, and the brachiocephalic veins right and left, and the branches of arch of aorta, that is brachiocephalic artery, left common carotid artery, left subclavian artery. Also we can see the trachea, then the right and left vagus nerve, cardiac nerves, phrenic nerves which are passing through the superior mediastinum. Then here we can see the apex of lungs. These are also forming the content of the superior mediastinum. So in this way we should give some detail about the contents of the mediastinum. So here we include the arch of aorta with its three major branches which are lying in the superior mediastinum. It provides brachiocephalic artery which is supplying to the right side of head and neck and right upper limb. Left common carotid artery supplies to the left side of the head and neck, and the left subclavian artery supplies to the left upper limb. Then we have superior vena cava with its tributaries, which are located within the superior mediastinum. It has the brachiocephalic veins, which are draining the blood, venous blood from the upper part of the body. And we have the azygous vein, which is receiving the blood from the right posterior intercostal veins. Then we have the nerves. So in the superior mediastinum, we have right and left vagus nerves. So right vagus nerve, this passes posteriorly to the superior vena cava and the right primary bronchus, while the left vagus nerve, this enters the superior mediastinum between the left common carotid and left subclavian arteries. Then we have the left recurrent laryngeal nerve, which arises from the left vagus nerve as it passes through the aortic arch. Then we have the phrenic nerve, which arises from the roots of C3, 4, 5 and it supplies to the diaphragm. Then other nerves which are found in the superior mediastinum, these are the cardiac nerves, which are arising from the superior, middle and inferior cardiac ganglion and form the superficial and deep cardiac plexus in the superior mediastinum to supply the heart. Then we have the sympathetic trunk, which runs bilaterally to the vertebral bodies along the entire length of the vertebral column. Other structures which are found in the superior mediastinum, these are thymus, then trachea, esophagus, thoracic duct. Thoracic duct passes to the left of the esophagus or its part to the junction of the left interjugular and the subclavian veins. When the muscles, these are the sternohyoid muscles and longus coeli, which are the contents of superior mediastinum. In the diagram, we can see sternothyroid and sternohyoid muscles. Then we come to the anterior mediastinum, lying anteriorly to the middle mediastinum. The boundaries are anteriorly, it is bounded by the body of sternum, as we can see in the diagram. So it is formed by the body of sternum. Posteriorly, we have the pericardium, which is enclosing the heart. On the sides, we have the mediastinal pleura. Superiorly, the imaginary plane, and inferiorly, we have the diaphragm. Now the contents of anterior mediastinum, these are thymus, sternopericardial ligaments, internal thoracic artery and its branches, lymphatics and lymph nodes, and areolar tissue. Then we have the middle mediastinum. So boundaries are anteriorly we have sternopericardial ligament, which is the content of anterior mediastinum, and posteriorly we have the contents of posterior mediastinum, that is the esophagus, descending thoracic aorta, azygous vein. Contents are heart, which is enclosed in the pericardium, and its main vessels, that is the ascending aorta, pulmonary trunk with its right and left branches. Then we have veins, superior vena cava, termination of azygous and pulmonary veins. We have nerves like phrenic, deep cardiac plexus with bifurcation of trachea and tracheobronchial lymph nodes. So we have to give some details about these contents, like the detail of some heart, pericardium and the great vessels, like ascending aorta, which is the first part of the aorta, and it is passing upwards and exiting the fibrous pericardium and entering the superior mediastinum. Then we have pulmonary trunk, which gives the right and left pulmonary arteries, and the superior vena cava, this is returning the deoxygenated blood from the upper half of the body. Then the nerves which are found in the middle mediastinum, these are the cardiac plexus, which are supplying to the heart. This cardiac plexus is formed by the sympathetic as well as parasympathetic nerves. So the sympathetic innervation is provided by the T1 and T4 spinal nerve segments, while the parasympathetic nerve component, this is from the vagus nerve. Then we have the phrenic nerve. Phrenic nerve is a mixed nerve. It provides motor innervation to the diaphragm. Then we have lymphatics, mainly the tracheobronchial lymph nodes, which are located in the middle mediastinum. These lymph nodes, these are associated with the trachea and the bronchi, and these are located close to the hilum of the lungs. Then we have posterior mediastinum. Posterior mediastinum, it is having a boundaries like anteriorly, it is having the pericardium with bifurcation of trachea. Then posteriorly we can see the lower 4, lower 8 thoracic vertebrae, and superiorly we can see the transverse plane, and inferiorly we have the diaphragm. And on the sides we have the mediastinal pleura. Now the contents of posterior mediastinum, these are esophagus, arteries like descending aorta with its branches, veins like azygous, hemiazygous and accessory hemiazygous veins. Then we have nerve like vagus, splanchnic nerves, thoracic duct and the lymph nodes like posterior mediastinal group of lymph nodes. So we have to give here also some detail. So in the case of thoracic aorta, we can say that it is a continuation of the arch of aorta as it descends through the posterior mediastinum to the left of the vertebrae. At the inferior border of T12, the thoracic aorta becomes the abdominal aorta when it passes through the aortic hiatus. Aortic hiatus is nothing but an opening in the diaphragm which is providing passage for this thoracic aorta. It provides some branches on the anterior, lateral and posterior lateral sides. The major branches of thoracic aorta, these are posterior intercostal arteries, bronchial arteries, esophageal arteries and superior phrenic arteries. Then the thoracic duct, this is the largest lymphatic vessel in the body and it is originate in the form of cisterna chyli in the abdomen. It also passes through the aortic hiatus and then it is draining the major portion of our body except the right part of head and neck and right upper limb. Then we have the azygous veins. Azygous vein is formed by the union of right lumbar and right subcostal vein. So here we can see the right subcostal and right lumbar vein which are uniting to form the azygous vein. This enters the mediastinum via the aortic hiatus. So it is also passing through the aortic hiatus in the diaphragm and is draining into the superior vena cava. Corresponding to it, on the left side we have hemiazygous vein which is formed by the union of left lumbar and left subcostal vein. It passes through the left crus of the diaphragm. Then we have in the upper part the accessory hemiazygous vein which is formed by the union of 4 to 8 intercostal veins which drains into the azygous vein at the level of T7 vertebrae. Then we have the esophagus which passes in the posterior mediastinum from the superior mediastinum, descending posteriorly to the arch of aorta to the heart and the heart. It is also leaving the mediastinum through the esophageal hiatus. Again in the diaphragm we have an opening for providing passage for esophagus which is known as the esophageal opening. It is surrounded by esophageal plexus through its course which is formed by the right and left vagus nerve. Then we have sympathetic chain over here. We can see the sympathetic paired. These are paired bundles of nerves which are extending from the base of skull to the causis and the thoracic region. These nerves bundles, these are known as thoracic sympathetic trunks. These trunks, they are providing the lower thoracic splanchnic nerves which are continuous downwards in the abdomen to supply the viscera. Then if we can see a chest radiograph, we can visualize some important structures like in the one part in this first image on the left side we can see the first is the superior vena cava. This is the aortic arch below that at the second point. Then the third point we have the right atrium and below that we have inferior vena cava in the fourth point. The B image, this is the lateral view of the chest. Here we can see the middle mediastinum which is highlighted having the heart image. Anterior to it we have the anterior mediastinum and posterior to it we have the posterior mediastinum. So these are the chest x-rays for visualizing the parts of heart and the middle mediastinum. Then the clinical anatomy. First is the mediastinitis. It is the inflammation of the loose connective tissue of the mediastinum. So this is the mediastinitis. Then we have mediastinal syndrome. Here we have the compression by any growth which is giving subgroup of signs and symptoms. These includes the engorgement of veins, dyspnea. Dyspnea means the difficulty in breathing. Dysphagia means difficulty in swallowing. Then we have hoarseness of voice in case of mediastinal syndrome by the compression of the vagus nerve. Then the next one is the mediastinal widening. It is due to the hemorrhage from the great vessels of the heart or because of the enlargement of mediastinal lymph nodes and the enlargement of the heart. Then we have the mediastinal shift. In this, there is a shifting of mediastinal contents to the unaffected side because of some disease in the lung. So this condition is known as mediastinal shift. So this is all about the mediastinum. Thanks for watching.